Now, as super specialists, we always strive to bring the most advanced technologies, the cutting edge techniques to our native place. And I'm extremely elated and proud to inform everyone that we have performed was first HIPEC surgery at our hospital last week.
Big Tycoon brings to you settlement plot at Dargal near Mopa Airport. Price starts from 15,000 rupees per square meter.
So HIPEC, which stands for hypothermic intraperitoneal chemotherapy, it is the most advanced surgery of its kind, which provides the maximum benefit and survival benefit to these patients who are eligible for it. So this surgery at present is done in very few selected centers across India, the top institutes such as AIMS and the corporate hospitals in the metro cities, and now it is done in Goa also. So before commenting on HIPEC, I would first like to tell you what peritoneum is. So peritoneum is a thin protective membrane which covers all the organs inside our abdomen. It is also the part where advanced cancers spread to very commonly. So when an ovarian cancer spreads to the peritoneum, it is considered stage 3, and when other cancers spread to it, it is considered stage 4. So these are the tumors which most of the doctors around the world call as incurable cancers and will refer them outside Goa. And HIPEC specifically benefits these patients. So ovarian cancer, stage 3, stage 4, pseudomyxomas, which is most of the time a stage 4 appendix cancer, mesotheliomas, which is a type of cancer which originates from the peritoneum, some stage 4 colon cancers, some stage 4 stomach cancers. So these are the ones which benefit from HIPEC. Now the benefit of HIPEC is that it significantly increases the survival in these patients. In well selected patients, it may even double the lifespan of these patients. In fact, there are many patients with pseudomyxoma which after a proper HIPEC have lived for more than 10 years also. Now considering it is a stage 4 cancer, this is almost miraculous. Now HIPEC, which is hypothermic intraperitoneal chemotherapy, it consists of two parts. Now the first part is a surgery where we meticulously search for all the cancer deposits inside the abdomen. We remove them. Sometimes the whole peritoneum is engulfed with the tumor cells, in which we have to remove the entire peritoneum. Now this part may last for anywhere between 4 hours to almost a day. The second part consists of chemotherapy. In the open abdomen, we install chemotherapy at a high temperature, around 41 to 42 degrees. We keep it circulating for around 90 minutes, and the chemotherapy acts over there. Now, to do this, we have a very specialized machine which ensures that this optimum temperature is maintained inside the cavity. Because again, a temperature less than this is not effective. A temperature higher than that can cause complications. So the whole thing may last anywhere between 6 hours to 24 hours. Now, in our case was an advanced case of ovary cancer. She received 3 cycles of chemotherapy. She responded beautifully to that and was eligible for surgery within a manner of 3 months. The surgery itself lasted for 12 hours. She had a quick recovery and was fit for discharge by 6 days. Now, many people ask me why this intra-abdominal chemotherapy is superior to the injection chemotherapy or IV chemotherapy, which we usually commonly see. Now, peritoneum is a semi-permeable membrane. It's kind of a filter. It does not allow all the molecules to pass through it. So, large molecules such as the chemotherapy molecules do not effectively pass through the peritoneum. So, whatever drug we give through the injection, hardly 10% of that actually reaches these tumor deposits in the peritoneum. So, this is where your intraperitoneal chemotherapy comes. The chemotherapy is directly given on the surface of these residual tumor cells, the microscopic cells, because obviously all the visible cells, all the palpable cells will be removed during surgery. Heat increases the penetration of chemotherapy, and together it multiplies the effect of the chemotherapy. Now, in addition to the expertise required for surgery,
this HIPEC surgery is a challenging surgery. Okay, associated with that, it's a prolonged, long duration surgery. So the anesthetic management is also challenging. Okay, so the main concerns during anesthesia management were the patients are usually, these are elderly patients, plus the surgery is a prolonged duration surgery, and it is associated with multiple hemodynamic changes like BP fluctuations occur and lot of fluid loss because of the prolonged surgery. Also it is a major surgery, so there is pain associated with the surgery and also associated electrolyte disturbances and also coagulation abnormalities are seen. Okay, so all these challenges were managed successfully by the team of doctors from RG, including surgeon, anesthesiologist, paramedic staff, and all the other supporting staff, and also the patient was shifted to ICU, and because of the aggressive management we could manage the patient well and could extubate the patient, and patient could be discharged on the 6th post-op day.